Hello, everybody, and welcome back to the COVID Camper. My name is John Blanchard. I'm a family physician with SALTA Direct Primary Care, and today is April 7th and day number 15 in the camper. We've had some questions today about how to treat people at home if they have COVID or suspected COVID. So, if you have a family member who has all the classic symptoms of COVID, the fever, the cough, the aches and pains, sometimes you can get intestinal symptoms like nausea, vomiting, diarrhea. Sometimes you can lose taste and smell. Those are some of the symptoms that people have. Sometimes you can have just mild symptoms like a common cold. But if somebody has symptoms and you can't get tested, which a lot of people are having a difficult time getting tested, you have to assume that that could be COVID and they should be isolated in the home. And that can be difficult, but if there's a room that they could stay in separately, or if they can use a separate bathroom, that would be very helpful. When you're in the room with the person, they should wear a cloth mask over their mouth, or you can wear a cloth mask, or both. If they use utensils, plates, and that kind of thing, you want to make sure that those are washed right away, and you wash your hands after interacting with the person that's in the home. You want to try to get as much separation as you can. The other thing that you can do is take their laundry, and you can wash their laundry in hot water, and again, wash your hands carefully afterwards. Daily, you should wipe down all the hard surfaces, especially doorknobs and those things. If the person that has symptoms is going about the house, you want to kind of wash those things down. It is possible for people to be in a home and still not contract the virus from the other person. It's not easy, but it's possible. So you want to take those precautions. One of the things that I hope comes out of this experience, like I said, is that people would take the time to learn more about mindfulness and meditation and counteracting the stress response in life. And I want to just demonstrate to you what it looks like to have to do deep breathing. And this is usually how we start a meditation. And again, meditation is, it's not thinking. You can't stop thinking, but it's about filling your mind with a mantra, which is a repetitive sound or a repetitive muscular movement or a repetitive prayer or a repetitive word. But we always start in the same way, and that's with doing some deep breathing. And you can even do this without the meditation. You could just take a few deep breaths, cleansing breaths, which tends to help to decrease that stress response. So if you're feeling very anxious, very stressed, you can just simply do what's called abdominal breathing. If you can put your hand on your abdomen and take some slow, deep breaths through your mouth where your abdomen comes out. Instead of you're not chest breathing like this, but you're breathing with your abdomen coming out, and that allows you to get a much deeper breath. You breathe in through your nose and out through your mouth, and you do it loud enough where people can actually hear if they're sitting by you, and it kind of looks like this. And surprisingly, if you do two or three of those deep cleansing breaths, you can actually really begin to elicit the start of a relaxation response. And again, that's usually how we start when we go into a meditation then. And you can learn more about meditation by looking at different apps or things online. You can search meditation techniques, how to meditate. You can go to Headspace. There's a number of different apps out there that help explain meditation, but it's a very important component to counteracting the stress response, especially during this time. During these videos, we've also been talking about thought distortions and identifying when you're in a thought distortion. We've covered black and white thinking, and we've also covered personalization. Tomorrow I'm going to cover something called should statements, something that we do frequently as a thought distortion called should statements. One of the things that I'm really proud of in direct primary care, and why I like to be a direct primary care physician, is how we've been able to respond to this COVID virus. So we've talked a lot about monitoring your symptoms at home and how important that is. a really important component of that is monitoring the oxygen level in the blood. So the vast majority of people are going to recover from this virus, but sometimes in the second week we're seeing people beginning to have difficulty with breathing, and it can be hard to assess how low the oxygen level is going. So one of the things that we're implementing in our practice at SALTA Direct Primary Care is the ability for our patients to drive by and have an oxygen level check. So we're identifying people who, first of all, have COVID that are in our practice, and then we're monitoring them closely. We're following up every 2 days. Then if they develop shortness of breath, that elevates the concern. So we're following up with them daily, and then we're also offering the ability for them to come in so we can check their oxygen, check their breathing, see how they're doing, do a clinical assessment to determine whether they need oxygen at home or if they need to have their care elevated to an emergency room or hospital. So this is a really important component of the treatment process during this time, and so you need to be in close contact with your provider. Most primary care providers have these pulse oximetries. They can monitor your symptoms. You can monitor your symptoms at home. They can check your pulse ox if you go into the office. So it's an important component of safely managing these symptoms at home. If you want to follow us on Facebook, you can go to facebook.com/Salta of Clarkston or facebook.com/Salta of Troy. And if you want to learn about whether SALTA Direct Primary Care can work for you, simply call Kyle at 248-922-3076, and he can answer all your questions or get you registered for the practice. Stay safe out there, love each other, and we'll see you again tomorrow.